You're listening to the Dr. Geo Prostate Podcast, where real talk meets real science to help men take charge of their prostate health and overall well-being. Today's episode unpacks President Biden's recent diagnosis of advanced prostate cancer. You'll learn what this means medically, what could have been done differently, and what you can do to protect your own health. Now, let's join Dr. Geo.
Before I proceed, I just want to clarify that this podcast and all Dr. Geo content is separate from my faculty position at NYU Langone Health. The views and opinions on this podcast are my own. Our guests and sponsors are curated by me and not affiliated with NYU Langone Health. Sponsors are a way for us to provide high quality information at no cost to you so that you can take better charge of your prostate health, testosterone, and erectile function, and also how to live better with age. Welcome to the Dr. Geo Prostate Podcast. I'm your host, Dr. Geo, here to talk today about the recent news of President Biden's diagnosis with advanced prostate cancer. You heard it, I'm sure, in the news outlets that President Biden was recently diagnosed with Gleason 9 prostate cancer that's spread to the bone. Those are all the details that I learned about, probably all the details you know about as well. There was no disclosure of his PSA score, which I have to assume it was pretty high. There was no disclosure of how many areas of his body had prostate cancer. How many bones? Was it pelvic bone only, or was it pelvic bone and vertebral bone, backbone? Was it, clavicle? Was it a rib? Was it where? We don't know. We just know that he has advanced prostate cancer, Gleason 9, also known as Gleason grade 5. Okay, that's the highest in that grading system, Gleason grade 5, and spread to the bone. So the first question I have is, how can a president of the United States who has access to the best doctors right away and a devoted urologist, because my understanding is that the president of the United States has a specific branch of every medical specialist that's devoted to the president. So neurologist, cardiologist, endocrinologist, oncologist, and of course, urologist. So if they would have had his PSA scores from 5-10 years ago, you would have seen that PSA was high, perhaps get a biopsy, get it when it's still encapsulated in the prostate, and then get it treated. But that was not the case, apparently. At 82 years old, they found it now. And it's a head scratcher because I'm wondering, was it because his physicians were following some of the medical guidelines that suggest not to screen with PSA tests men over 70? There's a few medical guidelines that suggest no screening for prostate cancer with the utilization of PSA after the age of 70, which that's, of course, preposterous, because the idea there is that a man over 70 will unlikely die from prostate cancer, even if they have it, and they'll die from other things. Preposterous. Why? Because most men I see clinically are in great shape in their 70s. Great shape. Many of them have parents who died in their 90s. I'm not sure what happened there. I don't know. There is no way that he has access. The president of the United States has access to getting daily PSA if he wanted to, so that they can see the trend. So it's a head scratcher. The next point I want to make is to define advanced prostate cancer. What does that mean? So advanced prostate cancer is any cancer that has several elements to it, or classifications. Number one is that even if the cancer is encapsulated, so it's not outside of the prostate, but is a Gleason 9 or a Gleason grade 5, that's considered advanced prostate cancer. Then if it's a Gleason grade 9 plus a little bit on the outside of the capsule, where they, when you get a prostatectomy, the prostate gets removed, you get positive margins. That's what it's called, positive margins. That's considered advanced prostate cancer. And then, of course, when it's outside of the capsule, regardless of where it is advanced prostate cancer. Typically, prostate cancer, when it leaves the capsule, it goes into the lymph nodes nearby or the seminal vesicles. And one of the main other organ systems it goes to is the bone. So it goes to the bone, is the primary place it goes. Yes, it can go to the lungs and other soft tissue, but primarily it goes to the bone, and that's what President Biden has. Then within advanced prostate cancer that has left the prostate, there is hormone-sensitive prostate cancer, which means what? It means that hormones, androgens, primarily testosterone and all the other different androgens, dihydrotestosterone, those hormones can stimulate those cancer cells and possibly make it grow. And those type of castrate-sensitive prostate cancer responds favorably, typically, to what's called anti-androgens or chemical castration, which is the pharmaceutical drugs that brings testosterone down to castrate levels. Then beyond that, you have castrate-resistant prostate cancer. So these are people that do not respond to anti-androgens and androgen deprivation therapy, and still the cancer grows. PSA keeps elevating, going higher, despite the fact that the patient is on anti-androgens. And then you have the more advanced type that are called neuroendocrine cancers. These are typically when someone is diagnosed with neuroendocrine cancers or prostate cancer, typically the PSA is actually really low. So it's like an incidental finding, but they have aggressive prostate cancer with a low PSA. I'm talking about PSA below 1, right? I had a case once with a fabulous gentleman who happened to be a physician, and he told his friend who's a radiologist, listen, can you get an MRI of my prostate? He said, why? You're young? He said, well, I'm just peeing a lot. I said, yeah, sure. Well, you're in your 50s now. That could just be BPH. Well, just get an MRI. But your PSA is, 0.9. Yeah, I know, but just you get an MRI. Do me a favor. He goes and gets the MRI, and he had Gleason 9 prostate cancer all over the prostate. And upon further imaging, it showed that he had cancer outside of his prostate to the bones. And there again, PSA low. It's called a neuroendocrine. Also, neuroendocrine cancer, prostate cancer, can occur after treatment. So it doesn't always have to start as a neuroendocrine. It could be hormone sensitive, castrate resistant, and then after castrate resistant, it can become neuroendocrine with time. Whether or not that's related to the excess use of androgen deprivation therapy, that's one of the theories, I think. And my last conversation, when we talked about triplet therapy with Dr. Rana McKay, we spoke about that a little bit. So you want to check that out. But the bottom line is that in some research and some data, that once you are an androgen deprivation therapy for a period of time, that then within time, that cancer can become neuroendocrine. We do know that within 2 to 3 years of continuous use of these anti-androgens, that the cancer becomes resistant, castrate resistant, between 2 to 3 years. That can be damaging to his cognition, which we already think just by observation that he was probably experiencing some dementia. Fatigue, sleep disturbance, of course, sexual function. I'm not sure that, I can't speak for him. I don't know him. I'm not sure that is of top interest. Maybe it is. Not because he's 82, but just because he looked weak and feeble. So my best guess would be that the treatment that he's already undergoing is anti-androgens, something like a Lupron or Orgovyx, or I would think it's Lupron, easy, 1 injection every 3 months, things like that. I think that he would have a hard time handling all the others, particularly in the triplet when you add in the docetaxel. That would be harsh. Now, I have many patients on the triplet therapy, but most of them are younger. Actually, all of them are younger and robust and strong, so they can handle it better. And they're doing just fine, but I don't think he can handle it well. The other treatment that it's an option is a radioligand treatment called lutetium-177, also known as Pluvicto, where it's a tracer, right? A radioligand tracer where they use a PSMA PET scan to identify the tumor. And through that PET scan, they inject the drug, lutetium-177, and wherever there's PSMA membrane, so PSMA is prostate-specific membrane antigen, most of those areas that light up in a PSMA PET scan can be treated through this particular type of treatment called lutetium-177, Pluvicto. and they'll find that cancer and get rid of it. Perhaps that is an option, assuming that his cancer reacts to the PSMA PET scan, right? Because not all prostate cancer have this membrane called PSMA, right? So if you can't see it on a PSMA PET scan, you can't treat it with Pluvicto or any radioligand. So maybe if they do a PET scan, which I'm sure a PSMA PET scan on him, maybe he's a candidate for Pluvicto, and maybe the side effect profile in that situation is a little bit less. My guess is that he's had hormone therapy already. Okay, that would be my best guess. And, there's always natural approaches to do with the medical treatments. Things like diet. Much of the research that shows post-diagnosis of prostate cancer, so this is not just for prevention, this is post-diagnosis, that lifestyle approaches can reduce the risk of mortality, of death, by up to 30, 40%. Those lifestyle approaches include diet, which includes actually a low-fat diet, a low-saturated fat diet, something, and I know that a lot of you think ketogenic diet. When you look at the research, most of it suggests that a high-fat diet, which is pretty much a ketogenic diet, right? A ketogenic diet is a very low-carb diet and a high-fat diet. Not even a high-protein diet. It's a high-fat diet. Much of the research shows that a high-saturated fat diet, so you can do a high-fat unsaturated, polyunsaturated diet, can increase the risk, or at least it was linked up, association, not causation, to advanced mortality from advanced prostate cancer after diagnosis, right? So it would include cruciferous vegetables. There seems to be a lot of data to support that patients after a diagnosis do better by eating a lot of cruciferous vegetables. This includes things like broccoli, Brussels sprouts, cauliflower, kale. I'm sure I'm missing one. Broccoli, Brussels sprouts, cauliflower, kale. Those are the main ones, but you can look it up either on the Dr. Geo website or elsewhere. drgeo.com, that is. So that's that. In terms of protein, I am a stickler to patients on androgen deprivation therapy, or ADT, to consume at least half of their weight, if not 0.6 grams of their weight in protein. Now, fish is the best option. Even there's some studies that suggest that higher consumption of fish after diagnosis reduce the risk of mortality in men compared to those that did not consume fish. With fish, you can have the potential anti-cancer benefits, and you also have the protein of particularly the essential amino acids, which you need to conserve muscle, right? So I think hopefully, President Biden will have plenty of access to good food. He probably has a personal chef. And if you're listening, personal chef of President Biden, listen up. He needs protein. Best source is fish. It's okay for him to eat the best quality meats as possible. I know that probably get some pushback on that, and that's okay. But once again, this is not only about preventing prostate cancer or the progression, which there's no evidence that red meat that's not overly cooked and it's not processed, there's no evidence that is linked to cancer formation or progression. But most importantly, the muscles need these proteins, because if not, then the quality of life will decrease rapidly while on anti-androgens and androgen deprivation therapy. Then is exercise. Got to get to the gym, President Biden. Got to get to the gym. Even if you don't feel like it, even if you are feeling fatigued. What I tell patients is typically, look, if you're exhausted, like you cannot even keep your eyelids up, don't push it. Go rest, go sleep. If you're tired, go work out. Go for 10 minutes. If you are even more tired after that or exhausted, then go back and go rest and go sleep. So exercise is crucially important to sustain quality of life. And I do believe, based on conversations and research with Dr. Robert Newton, again, who I had on a podcast, look for that one, Dr. Robert Newton, that exercise is medicine, and it even potentially has some anti-cancer benefits. So it's a nice combination of aerobic exercise and weight-resistant exercise 3 times a week. Doesn't matter your age, President Biden, and doesn't matter your age, whoever's watching with advanced prostate cancer. I know many men in their 80s who are in the gym and making it happen. It's remarkable what I see clinically, and they make it happen. Okay? So that, I try to get the best sleep as possible. I'm glad he's no longer president. Nothing to do with my political views, all to do with the fact that he would not be able to handle well the stressors that would come from being president. Honestly, he would probably not be able to do a great job just because of the potential decline in his health, not only from age, but also from the treatment itself. There are supplements, I think, that are essential in men with advanced prostate cancer. One of the ones, and this could be a whole series of podcasts, so I'm not getting into the weeds here, but everything from, well, what are you trying to accomplish, right? When you're taking the supplements, what are you trying to accomplish? You want to reduce the risk of side effects, adverse events from the treatment. So if it is anti-androgens and ADT, you want to keep cognition and mental health, right? Brain health. So there's a couple of botanicals that might work for that. That includes things like bacopa and lion's mane, for example, is a mushroom. You want good amounts of vitamin D, omega-3 fatty acids for the brain. Some people like to take ginkgo. That's fine. I prefer bacopa. It's an Indian herb, good for the brain. Then you want to keep your bones strong. And I know most people say, well, the calcium, I got to take calcium supplements. Not so fast. Not so fast. You don't want to take just calcium supplements. First of all, the best method of keeping the bone strong. And why is that important? Because one of the primary adverse events to androgen deprivation therapy is osteosporosis. So you need a baseline, President Biden, listen up, and any one of you who's watching, you need a baseline DEXA scan, which measures the strength of your bone as a baseline, right? And if there's either osteopenia or osteosporosis, then you want to do that test, the DEXA, every 6 to 12 months to just see where you're at that point. How you slow the progression of osteosporosis or osteopenia from a natural perspective is not just taking calcium pills. That's the last thing I actually give, is weight-resistant exercise. Okay? In addition to that, there are other minerals that are very important, including things like boron and magnesium, for example. Very important to keep bone strong. And then, of course, you can use some calcium, which it should be plentiful in food. The supplements or herbs are good quality anti-inflammatories. Curcumin is one of them. Quercetin. I like boswellia. Again, this could be a whole nother series, not even one podcast on what to do from a supplement perspective. And we have a course coming out on this, so stay tuned for that. So here's the bottom line and an overview of what I said. Number one, PSA matters, guys. PSA matters. Come on, let's stop with the, PSA doesn't matter, so I'm not getting it. Stop that nonsense. PSA matters. Is it the end-all, be-all? Of course not. But it matters. Prostate cancer can be caught early through this one test, simple test, inexpensive test. There are others heard on the podcast before, urine test. There are a few now. There's the Exosome DX test as the My Prostate 2.0. You're going to hear more about that soon in June. But PSA is a very good biomarker. So that's that. So again, I'm confused why President Biden at 82 has advanced prostate cancer. We define what advanced prostate cancer is and the medical treatments for it currently and some of the natural approaches. I do wish President Biden well. I'm not a big political person. I don't get emotional about politics. So don't attack me. If you are anti-President Biden, don't attack me for saying nice things about him and wishing him well. I wish him well. I wish every president well. And I predict that after that diagnosis, men can live a very long time, particularly men that are diagnosed with advanced prostate cancer at a young age could live a very long time. So it doesn't have to be a death sentence. Now, for an 82-year-old man who looks not in the best health, I'm not sure. Most of my patients who are in their 80s look in their 70s, not President Biden. So I do wish him well. And look, regardless of the stage and grade of prostate cancer that one has, you become a thriver. So you've heard me say this before, you're a self-health advocate, do the work, including with advanced prostate cancer, which is possible. Most men do not experience bone pain or any pain with advanced prostate cancer. If you do, there's limitations there, and there's ways of diminishing some of the pain. Be a thriver. See what you value. This is an opportunity to prioritize your values and to do more of the things you love, to spend more time with the people you love, and take action. Be proactive. You are in the driver's seat. It's not just your good doctors doing good work for you. It's also you doing the work as well. So I'm going to sign off here. Next time we hear more information about President Biden and his prostate cancer updates, I'll come back on and give you my opinion. So thanks for watching. Much love to you all. Again, you're always a prostate cancer thriver. So keep doing the work. And don't forget to go to drgeo.com, subscribe, because I'll be sending more information out to that newsletter audience. Much love to you all. Dr. Geo here, signing off. Talk to you next time.
We hope you enjoyed this episode. You will continue to receive powerful interviews and insights to support your prostate health journey. For those who want to dive deeper, our exclusive membership offers even more. The Dr. Geo Prostate Podcast is here to provide you with information and support on your prostate health journey. We are introducing our exclusive membership where you can get even more value from every episode. Every episode comes with detailed show notes, breaking down the key points so you don't have to take notes while listening. You'll also get curated transcripts so you can read and revisit everything you just heard. Perfect for learning at your own pace. And for every episode, you'll receive a handy list of resources, products, links, studies, and tools mentioned in the show, all in one place. That's not all. Members also enjoy special discounts on hand-picked products to support their health and wellness goals. And there's more. Members get exclusive access to Dr. Geo's monthly Ask Me Anything, where he answers questions submitted directly by the community. All of this for just $19 a month, or save 20% when you pay annually at only $182 a year. Smarter listening, deeper learning, better health. Join the Dr. Geo exclusive membership today. Start getting more from every episode.
Thanks for tuning in to this week's episode of the Dr. Geo Podcast. You can watch all episodes of this podcast and much more by subscribing to my YouTube channel. If you love what you heard today, you can help by leaving a 5-star review of the podcast on Apple and Spotify, as each review helps us reach more men who are serious about improving their urological health and how to function better with age. And for the latest research and actionable takeaways in the world of men's health and integrative urology, sign up for my newsletter at drgeo.com. I'll see you next time.